and welcome to the Art of Being Human. I didn't quite finish what I was going to say about headaches, so I want to continue and finish that. We won't need to have too much time. But head problems and pain in your head and headaches, it can be a serious matter. It can be chronic. And it doesn't help much if you go to the doctor and they say, well, it might be this, it might be that, it might be something else. We really don't know what it is, unless it's a serious issue, because what can they do? So you've got a headache. If it's a serious headache, and if you're getting them off and on, you're getting them regularly, and there's a pattern to it, you really need to check that out, because you may be one of those people that has a serious illness and it's showing up as a headache. And so you need to have that checked out. Most people have headaches, and when they're done, then they're okay till they have the next headache. And so most people's headaches are not so severe that they can't function. But if you've got cluster headaches, or if you've got migraine headaches, you can't really function with them. And it can be a serious, serious problem because, one, the pain is very, very severe. I can only count 1 or 2 times that I've actually had a headache bad enough for me to remember it. I usually don't get them at all. When I do get them, they're minor. They don't last very long, and I've never really had a problem. But I've had a lot of friends who have very serious problems with headaches, and they're always taking time off. They have to rest. They have to go into a room where it's quiet. They can't have stimulation. You know, if you have a bad headache and it's a migraine, you need to be quiet. You don't want to have sounds. You don't want to have a radio on. You don't want to have people talking. You don't want television to be on or anything like that. The quieter it is, the better it is, because all of the sounds just aggravate the headache and make it worse. And that's terrible, because you have to live that way. And I do think there are hormonal aspects to it, because, as I've told you before, when people start getting headaches and they're entering into their teen years and the hormones are coming out and doing what the hormones do, then that can be a cause of the headache. If you're a person that has menstrual problems, that can also cause headaches. So I think there is a definite hormonal component, especially in women, but you can have hormonal components in men as well. Men can go through menopause. It's usually never talked about, but they can have the symptoms of menopause, which is usually not as severe as women have, but nonetheless they can have it, and they can have headaches. Head injury is the worst thing that you would have to be concerned about, so I just want to say a little bit about head injury, and then we'll go on to something else. Now, if you have a head injury, it can cause brain swelling, and that swelling is called edema. The word edema, E-D-E-M-A, can be used in lots of situations where there's swelling. You can have edema of your feet. You can have edema of your legs. It's a swelling. So there's fluids developing. There are some times when you can be allergic to a medication. I was given a medication that was supposedly a new medication. It was supposed to help diabetes, and all of a sudden I gained like 14 pounds, and I did it within 6 or 7 days, and I wasn't eating that much. And I thought, why is this? And I went to the doctor, and I was very, very allergic to the pills, and they worked with the kidneys, but what they did was they caused me to gain weight, and it was all water weight. And some people had that problem with the medication, so I couldn't take it anymore. So swelling and edema can be very serious. Nobody wants to have edema by their heart. They don't want water around their heart. They don't want water in their lungs. Water surrounding their lungs can be a problem, and it's always watched for. If you've had heart surgery, open heart surgery, they always make sure that you don't have too much fluids building up in the heart area, because you have to heal from the surgery. Now, if the injury to your head, whether it's from a concussion or somebody threw something at you, or you had a ball hit your head if you're playing a game, if the head injury is mild, you might not have hardly any symptoms at all. You might have just a simple, slight headache that doesn't last very long. If you have a concussion, in a concussion, the brain is shaken, and it's moving inside of the skull. So some of the tissue sometimes gets torn off the top of the brain because it's hitting the resistance of the skull, and some of the cells die, and that can be much more serious. So some cells, you lose some cells, and you can have symptoms. Now, concussions can cause the following symptoms. It can cause you to feel confused, can cause you to feel dizzy. You can have blurred vision. You can be unconscious for a while. You can have amnesia, especially if a skull fracture is involved. I can remember I was, as a young adult, working with some children at a kind of a Christian camp. And I was just working with them and paying attention to what I was doing, and a couple of girls decided they wanted to move a tripod, a big, heavy tripod, and it took two of them to move it. But I was standing around working with people. I didn't pay any attention to that. I wasn't involved with that, so they decided to lift it over my head, and wouldn't you know, they dropped it on my head. So I had this huge, heavy tripod land right on top of my head, and I knew the instant that it hit that this is not going to be a good thing. So I left. I should not have driven myself to the hospital, but I drove myself to the hospital. Somebody should have taken me, because something like that, you could become unconscious. But at any rate, I made it to the hospital, and I had a little concussion. Not a serious concussion like football players have when they get hit all the time, but it was nonetheless a concussion. And I found that I couldn't think quite clearly. My thoughts weren't as clear as usual. I wasn't exactly dizzy, but a little bit on the lightheaded side. I couldn't think, my vision wasn't quite clear. And those are symptoms, of course, of concussion. And I didn't have any amnesia. There's no skull fracture or anything like that. But if you are involved with sports, or something drops on your head, or you fall and you land on your head, you really need to have that checked out, because if you do have a head injury and you do develop edema, that's going to cause pressure on the brain. The brain, if it swells, if it has fluid, and it has pressure against the skull, can cause brain damage. You know, some children are born and they don't have the normal cerebrospinal fluid, or they have too much cerebrospinal fluid, and so the brain gets cramped up because they're too loaded up with the fluid, and they have brain problems. So you have to check everything out. Now, if the person is unconscious, the longer the person is unconscious, the more serious the injury is of the brain, and some people will pass out. They will pass out. So it is a problem. So if you have symptoms of vomiting, or if your pupils are of unequal size, that's very, very serious. That has to be checked out. Or you have double vision. If you have double vision, the size of your pupils aren't in sync with each other, that's a problem. Or if you have a deteriorating level of consciousness, then that shows progressive brain damage. There have been people who have gotten into accidents in which it is suspected they have a head injury, and they ask them to go to the hospital. Oh no, I'm feeling fine, I'll be okay. They don't start developing symptoms for maybe a few hours after the injury. And what happens is there's bleeding in the brain. And they don't feel it right away, but then that bleeding in the brain will kill them. Symptoms sometimes begin immediately after an injury, and that obviously, if you're having symptoms, you get it checked out. Seizures, you can get seizures after you have something penetrate the brain, or you have a skull fracture, or you have a brain hemorrhage. So recovery can be slow. If you have a brain injury, the recovery can be slow. It may take up to 5 years to recover from a brain injury. I'm concerned about all of the concussions that people are getting playing football. You know, usually they pass it off, oh, I'm okay, but they're not okay because they don't have all the symptoms. They don't know what's going on in the inside of their brain. They don't know if they've torn a blood vessel or possibly getting bleeding on the brain somewhere, which may not show up for a while, but is there, and then suddenly they're sick and suddenly they're unconscious. Suddenly they can't move right, or they go into seizures and so forth. So any kind of a head injury, go to the hospital, have somebody take you to the hospital and get it checked out. For the most part, though, and I'm going to repeat this, and I know I said it last time, for the most part, most headaches are not serious enough to cause you to be concerned that there's something terrible going on in the brain or in the skull. They're headaches that they come for various reasons and they leave for various reasons. And there's no one cause of a headache, usually, unless you've had a brain injury or if you've been into an accident or you've fallen on your head or something like that, then of course you would suspect an injury right away. But if it's just you get a headache and it leaves, you get another headache and it leaves, usually there's no one cause of it. But you might be able to figure out the cause of it yourself because you know, what did you eat before you have the headache? Was there a big temperature change? Were you in a stuffy room? You know, did you eat anything unusual that you normally don't eat? Were you exercising a lot and not taking rest breaks? Did you hydrate properly? Did you have enough to drink? Or did you not bother to drink and you just exercise and exercise? Oh, I'll forego the water. I want to get this exercise cycle done. Or any of those things, you can pretty much pinpoint. If you are a person who is having problems with headaches, you need to pinpoint what did you do before the headache began, and just keep kind of a record of it, and then keep that record up to date because you can find out sometimes a lot of patterns that you may be going through that you might not be aware of. I know I used to counsel a lot of women, and they would have patterns of things, anxiety at certain times, nervousness at certain times, dizziness at certain times, and I would suspect some kind of a menopausal thing going on, and I used to have them keep a calendar. If you're doing well, put a check. If you're not doing well, then write a little note to yourself, get a big calendar and do this daily. And then you keep this for several months, and you can check back and see, well, I get a headache 3 days before my period is due, or I get a headache a week before my cycle starts to kick in. And it's the same thing every month. So when you have that information and there's a pattern that you're following, you may not be aware of the pattern unless you write it down. It's possible that you could go through a certain cycle and a certain time cycle for symptoms, and you could be doing it every month for like years and not even hardly notice it. But when you keep a record of it, then you can go to the doctor and say, this is when I start my headaches. 5 days before my cycle kicks in, then that's when I get my headache. Or 5 days after the cycle stops, that's when I get my headache. But it's every single month that way. Or I get a headache 3 times a week. It's always on a Friday. You know, there was a case of a girl who got headaches always on a Friday, and the doctors couldn't figure out why. Well, always on a Friday, she borrowed somebody else's car because her family or wherever she was living, somebody needed her car, and so she'd use somebody else's car, and they had a leak. You know, they had a leak of gases in the car. It was causing her to have a headache. And she didn't realize that. So she was getting a headache every week because of the car that she was driving. And so when that was corrected, then she didn't have those headaches anymore. Keep a record of what your symptoms are and be specific about the symptoms. Nauseous, not nauseous, headache, dizzy, whatever the symptoms are, and see if those symptoms repeat themselves according to a pattern. And I do this, or I have done it with a lot of the people that I've seen with counseling because I want to see what the pattern is myself. And then when I send them to a doctor or they go to a doctor, this is the pattern, this is what's happening, and this is when it's happening. That gives the doctor a lot of knowledge, and they can do something. They can say, well, this is the time when we add this hormone, or this is the time when we take that medication away, and they can figure out something that works for you. And also, if you know what's going to happen and when it's going to happen, you can steel yourself for it. Okay, I expect, and you have to be careful how you do this, because you don't want to just say, well, I have a headache every third Wednesday of the month or something like that. I'm making this up in my head, of course. But you don't want to say, well, I'm going to have a headache because this is when it always happens. But truthfully, if you know a pattern, then you know that's going to repeat itself, and it does repeat itself, then you can kind of be mentally prepared for it. This is a week that's probably not going to be a good week for me, because this is a week, the second week of the month, where I have certain problems and they come up repeatedly, and this is when I get my headaches, or this is when I get this kind of abdominal pain, or whatever it is. You need to know what the pattern is, and then when you know it, you can steel yourself for it, or you can go to the doctor and say, this is when it happens, this is what's happening, this is when it happens, and they can figure it out from there, whether you're lacking something in your system, or whether you're not lacking something in your system, but you need a change in your diet, or you need a change in something that you're doing that has to be different than you normally do. And so that's kind of important to remember that. So if you have a headache, if you are plagued by them, then they can become chronic, because they can become extremely painful. They can last for long periods of time. You don't know when they come, how long they're going to last, or if they're going to last for 2 or 3 days, or whether you're going to get rid of them in 4 or 5 hours. You have to be aware of yourself, and what you have is a pattern, and then get medical help for it, because there's no reason why you should have to go through it. I know people will say, well, it's just arthritis, I can put up with it. But you know, you don't have to put up with it. If you're in serious pain, you really can't put up with it and get anything done. So you shouldn't have to plan your life around your pain. You shouldn't have to plan your life around your headaches, but some people do. And I'm urging you to find what your patterns are and get help with that. Get help with that so you don't have to do it. And your life will drastically improve. So that's about all I want to say about headaches. I am concerned about what happens in concussions and things like that. And so we need to be aware of the fact that what seems normal to us because we're used to it may not be normal at all. Now, I don't have a whole lot of time left, so I think I'll close it here. Instead of starting something and getting a little bit into it, and then I have to stop it because I can't get any further because we're running out of time, I'm going to start arthritis. There's a lot about arthritis that I've researched out, and most people have it when they get certain age, and I have it too, everybody does, but there are different types of arthritis, there are different types of treatment, there are different things you can do for it to help yourself feel better. Some of it is more serious than others, and I really want to go into it because arthritis not only is common, like headaches are common, but is a source of a lot of pain, and you can do things about that pain. So I'm going to close it here, and we'll start arthritis next time. And then I'm dealing with these situations and these illnesses that give pain. I'm focusing on that right now because pain is chronic for many people, and they need help with it. So we'll close it here. Please join me next time.